Good day, folks. Alfie Vente here once again of Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. So this video is 8 questions about key clinical observations regarding migraine and TMJ dysfunction. So over the years, I've seen a number of patients that suffered from migraines or migraine-like symptoms. It seems from my observation that most, and dare I say all, have TMJ dysfunction symptoms. It also seems that intraoral massage, that's basically when I work into the mouth to work on those jaw muscles, it seems to potentially help migraine sufferers. Either they've been diagnosed with TMJ or have considered it a possibility based on the symptoms they might be feeling. So they might feel like their jaw feels very tight, they might feel clicking, so on and so forth. And by the way, just as a disclaimer, this is more for educational purposes. I'm not saying that massage is curative in regards to migraine symptoms. This is just my observations. I'm just kind of relaying to you what I've seen over the years. In fact, you probably will not find any research done in regards to this particular subject. So now, let's get on to our first question. So what's the typical scenario? So usually what happens is somebody comes in and they're coming in for an ailment that's not even related or doesn't seem related to migraines or TMJ. They might come in for neck pain, shoulder pain, lower back pain, and it's usually very chronic. These symptoms kind of erupt with the patient. And what happens is that before they come in, I do the health history. So I read it, and they take off potentially migraines. Maybe they even take off TMJ. All of a sudden, the conversation during the treatment's about their migraines. I ask them questions such as, how long have you had it for? What's the intensity like? So on and so forth. And I then ask, do you have TMJ symptoms? Do you have jaw issues? And then we go on into this conversation, and then we discuss further in regards to what I can do in regards to the work into the jaw to potentially help their symptoms. So that's the typical scenario. It's usually one of those things where they're not coming in for the migraines, for migraine issues or TMJ issues. What is your explanation as to what may link TMJ dysfunction to migraine? So this is a question that I get asked often. And this is my theory. This is just a theory. Again, there's really no research for this. But I believe that when somebody goes through a potential migraine, they become very tense. They become more anxious, more stressed. All of a sudden now they're clenching their jaw muscles. They're tensing up. Maybe they're even tensing up their shoulder muscles. And generally speaking, there tends to be a lot more, the type of patients I see, they tend to have more anxiety. And therefore, they have a predisposition to becoming very, very tight, at least with their muscles and their fascia. So what I believe happens is because of all the tightness that occurs with the muscles of the jaw, from clenching, from being tense and anxious, it actually exacerbates the person's condition. So on top of the migraine, they're also getting pain because of the TMJ muscles becoming very tight, causing potential issues in the head and the face. Giving them potential things such as like ringing the ears, plugging the ears, a bit of dizziness, maybe some nausea. So those are some of the things that can happen when the TMJ becomes very tight. So you add that onto the person's migraine symptoms and it makes things a lot worse. The third question is, what does a typical treatment look like? So the typical treatment, usually what happens, like as I said before, I might be working on the lower back because the person has come in because of the lower back with their hip, maybe their shoulder and neck. And then when we get to the TMJ portion of things, this usually happens maybe after the initial treatments that we do for the person's like hip or lower back, whatever condition I'm working with. And we'll work on the back, we'll work on the neck and the shoulders. They're usually lying face down first. What I want to look for is any tightness in the neck and the shoulders that could also be exacerbating the person's condition. Then when we turn them over, when they're face up, what I do is I get my surgical gloves and I actually work inside the mouth. And this generally takes 20, 30, sometimes 45 minutes depending on the tightness of the jaw. And so then the focus of this particular treatment is to release the jaw muscles inside the mouth. I can work on the outside, but there's actually muscles inside the mouth that I really need to access and get to loosen up. And by the way, when it does loosen up, what I find is that the neck muscles also follow with it, so it becomes a lot softer. And that's basically what a typical treatment looks like. Number 4, after the treatment, what observations and patient feedback have you encountered? For one thing, they'll typically say, well, it feels kind of tender, it feels very sore. That's because usually they haven't had their jaw worked on. It's not one of those things where you kind of go into a treatment for the first time and say, I need my jaw worked on. Rarely do I get that. But because the jaw muscles are so tight, I'm working on it, it becomes very, very sensitive. So that's one thing. The second thing is that the person usually notices that their jaw is moving better. And the third thing is that they feel that their head feels a lot clearer. It doesn't feel, they may have decreased headaches. And also they find that their neck is actually moving better. So those are a few things that I've found, and also what patients have given me in terms of feedback after a treatment working into the jaw. So before I go on to the next few questions, if you like our content, please like, share, subscribe. Pass this on to those that you feel this might be helpful for. And if you are on YouTube watching this, please hit that notification bell. We really appreciate it. Thank you very much. So let's go on. What is the general feedback after a few treatments? So this is more towards the issue with the person that might be suffering from migraines. So depending on how chronic the issue is with the jaw, what generally happens is after a few treatments, they may notice that the frequency decreases. So they may get like migraines once or twice or 3 times a week. All of a sudden now it's like twice if they've had it 3 times. All of a sudden it's once if they've had it twice. And that's what they find, the duration. They find the intensity actually decreasing also, and also the time frame in terms of how long they have these migraines. So a lot of those things linked to the symptoms of the migraine tends to die down, and there seems to be a relationship with the jaw in regards to when it feels like a lot softer. These symptoms tend to fade even more. How uncomfortable can the treatments be? Question number 6. Well, they can be very uncomfortable, let me tell you. I'll be frank with you. It's not the most comfortable one, especially if you have had TMJ issues. Like, I know there's a number of you guys out there that wear mouth guards, but let me just say, like, mouth guards are great to prevent the grinding of the teeth, maybe wearing it down, but it won't stop you from clenching your teeth maybe at night. Maybe you've had a habit of like really, really tightening up those jaw muscles. Maybe you clench them during the day because you're so stressed out and anxious. So really, it's all relative to how tight the jaw is. But if you suffer from migraine, I've got a feeling that for the most part, the jaw is going to be extra, extra tight. So during treatment, during the first few treatments, you will feel like there's going to be a certain level of discomfort. And during treatment, I do tell patients, like, just make sure you wave your hand to let me know that you just want to sort of like, you want me to lay off a bit, maybe even stop the treatment. But honestly, like, I think this type of treatment, especially if it's a chronic one, and this is not just the jaw. It could be like somebody's neck, it could be somebody's shoulder, somebody's leg, whatever it might be. If it's been super tight for quite a long time, there will be a level of discomfort for sure. Number 7, do you have a suggested treatment protocol for treatment? In fact, we do. So for people that have chronic issues, we strongly recommend doing 4 consecutive treatments once a week. So for 4 weeks, you're going to come in once a week for that hour to get the treatment done. It doesn't matter whether it's a TMJ, whether it's a neck or the hip, whatever it might be. If you've got a chronic issues, this is what we strongly suggest. Now, many of you guys may not be able to do it, but if you want the best results, what we found is that 4 seems to be a decent number. And this is in regards to actually reassessing, because I don't believe that 1 treatment is enough to sort of get a good grasp of like what's happening. I think 4 is a reasonable amount to see how the patient is like how the treatment's working for them or not working for them. So after the fourth treatment, what I generally do is I do a reassessment. We have a conversation, me and the patient, and we discuss how they feel the progress is, and then we go on from there. Finally, number 8, do you suggest a maintenance program after the initial set of treatments? And before I answer this final question, we also have our social media, so we invite you to follow us on our social media. And also, don't forget, we have our pain relief fitness website, vprc.ca. This is where we discuss things and give you tips in regards to managing your own pain, helping you to continue on with your fitness program while doing things such as like stretches, pressure points, fascial techniques to help you along the way. So now, do you suggest a maintenance program after the initial set of treatments? Indeed, we do. So with migraine, it might be an ongoing thing. For the most part, it usually is. It's one of those things where you have to make sure that if there is a link between the jaw and your symptoms of migraines, you want to make sure that the jaw stays loose. And if you're a person that is generally anxious, tends to get stressed out, has a very stressful job, and you have habitual things that you, such as like a forward head position, maybe you're clenching your teeth, maybe you're grinding your teeth at night, it is highly recommended that you come in after the initial set of treatments once a month, just to make sure that the muscles stay nice and soft, so you maintain that level of comfort in regards to your potential TMJ and migraine symptoms. So, thank you very much for watching. We really appreciate it. Again, please like, share, subscribe. Hit that notification bell if you are on YouTube watching this. And again, visit our social media. We really appreciate it. My name again is Alfie Vente of Vente Pain Relief Clinic and vprc.ca. If you've got any questions, please feel free to give us a call at 416-644-8894. That's our clinic number in downtown Toronto. In the financial district, King and Bay at First Canadian Place. You can also email us at admin@ventepainrelief.com. Again, we really appreciate you watching us. We hope to see you in the next video. Have yourself a great day and take care, please.